Hi, my name is Leanne Burgau. I'm the owner of Burgau Insurance in Perham. We're an independent agency specializing in the Medicare health and prescription plans and also individual and family insurance. And I'm here today to talk a little bit about Medicare and what Medicare is. Whether you're just new to Medicare, if you've been on Medicare for years, it's important to understand Medicare, how it works, and the different parts to Medicare. So Medicare is a federal health plan designed to cover people age 65 or older, or some people under the age of 65 that have qualified for Medicare due to disability. So with Medicare, there are four parts: Part A, B, C, and D. Part A of Medicare covers all of your services while you're inpatient at the hospital. Typically, there's no premium for Part A. If you or a spouse has worked 40 quarters, you don't pay any additional premium for Part A. This year, Part A of Medicare has a deductible for days 1 through 60 of $1,364. Days 61 through 90, you would start paying $341 per day. Days 91 through 150, you would pay $682 per day. And day 151, Medicare no longer covers you while you're inpatient in the hospital. So that's Part A of Medicare. Part B of Medicare does have a premium. This year, that premium is $135.50 per month. If you are collecting Social Security, that premium comes from your Social Security check. If not, you are invoiced for that Part B premium. Part B covers all services while you're not admitted to the hospital. So things like doctors, ambulance, therapy fall under Part B of Medicare. Part B also covers preventative services. With Part B, there's a $185 deductible. Once that deductible is met, Medicare will pay 80% of the bill and you would have a 20% coinsurance. So Part A and B of Medicare is considered Original Medicare. With Original Medicare, one of the important things to remember is that there is no out-of-pocket maximum. Medicare doesn't say once you've spent $5,000 or $10,000, they'll cover you at 100%. You continue to pay your deductibles and coinsurances with no out-of-pocket maximum. So that is the reason that people will look at some type of supplemental coverage. Part C of Medicare are the Medicare Advantage plans. The other type of coverage that a person can choose is a Medigap plan. So that's probably one of the more important choices a person will make when deciding what type of coverage they will have to supplement their Medicare coverage. There's huge differences between Advantage plans and Medigap plans, so it's important to know those differences before making your choice. Advantage plans will typically have a lower premium, but then you do have copays, coinsurances, deductibles. It's more of a pay-as-you-go type plan, where a Medigap plan will have a higher premium, but then you'll have little or no cost when you use the insurance. Advantage plans typically have networks, and you need to stay within that network to receive the best cost on your health services. Medigap plans don't have networks. You're able to visit any provider, any facility that accepts Medicare. So there's no network with a Medigap plan, which is a huge benefit. The Advantage plans include the prescription coverage, which is Part D of Medicare. So with an Advantage plan, you have your health and prescription coverage rolled into one plan. A Medigap plan will not include drug coverage, so a separate drug plan needs to be added to that. The Advantage plans do change from year to year. They are yearly contracts between Medicare and the private insurance company, so they can change. The premiums, deductibles, copays, and the networks can change each year. Medigap plans are guaranteed renewable, which means the benefits won't change. Premiums can change from year to year, but the benefits won't change. Medigap plans will only cover what Medicare covers. Medicare doesn't cover eyewear, does not cover dental, does not cover hearing aids. So a Medigap plan won't have benefits for those specific services. Where Advantage plans will add some of those things in to make their plans more attractive. They will add dental coverage, coverage for hearing aids, and allowances for eyewear. So that's an important thing to look at also when looking at an Advantage plan, are those extra benefits that they offer. Advantage plans are a little bit more managed care. When you enroll in an Advantage plan, you are assigning your A and B of Medicare to the insurance company. So with an Advantage plan, there are sometimes referrals needed and prior authorizations are more common. Where with a Medigap plan, referrals and prior authorizations aren't needed. Probably one of the more important things to remember with a Medigap plan is that we have the first 6 months of someone becoming eligible for Medicare to enroll in a Medigap plan with no health questions. This is called a guaranteed issue, where you are able to enroll in that Medigap plan without answering health questions. After you've been eligible for Medicare for 6 months, then to enroll in a Medigap plan, you do need to answer those health questions. Where with an Advantage plan, there aren't any health questions, and Advantage plans can be changed every year during the open enrollment, October 15th to December 7th each year. So there's a lot of moving parts with Medicare, a lot of things to know. And it's important when you are first eligible for Medicare to explore all those options. So when you're looking at your Medicare options, whether it's for yourself or for a loved one, make sure you work with an agency that can compare all of the options available. Wherever you purchase your insurance, the premium is always the same. Whether you go direct to the company or work with an agency, the premium to the consumer is always the same. So work with somebody that can help answer those questions. Don't feel that you need to do it on your own. Medicare doesn't have to be scary. Make sure you find an agent that is knowledgeable, that is there to answer your questions and to compare those options every year to make sure that the plan that you are enrolled in is still the best option for your individual situation.